I've been waiting 2 months for an appointment. I went to my healer about the thing that you were mentioning about.
You are a receptionist, and unfortunately, the GP is double booked, and you have to inform the patient.
Hi, I'm here for my appointment at 11:30.
Oh, hi there. Was I speaking to you on the phone this morning for the appointment?
Yes, you were. I think you were, yeah.
Sure. Right. If it's okay, I'm just going to ask if we can just pop outside and have a conversation.
Okay.
Yeah,
All right.
brilliant.
Yeah, that's fine.
So unfortunately, I do have some bad news with regards to the appointment. It is entirely my mistake, but I double booked the doctor, and you were the second person that I booked, and so I've had to cancel your appointment so that the first person could have their appointment at your time.
Sorry, you've cancelled my booking.
I have, unfortunately, because
But I spoke to you over the phone.
You did, and I completely understand that it was my mistake, but I didn't notice that someone had already booked that time slot, and then I booked you in accidentally after that. So I've had to cancel yours because someone
But the doctor can't talk to both of us. Can they not make room?
Not. They're fully booked today. I have tried to ask, but they're fully booked today, and there's no room to have an additional patient today.
But that's not acceptable because I said I've got a problem with my heart.
I completely understand, and I'm sorry that this has happened. Can I ask, what is it that's gone wrong? What would you like to talk to the doctor about?
Yeah, it's a problem. Well, quite frankly, I don't want to really speak to you about it. I want to speak to the doctor about it. But it's a problem with my heart. It's just I'm getting the boom, 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 and sort of pain when I exercise.
Okay, I can see that. I've kind of put that down onto the system as well. But like I mentioned to you earlier, because there's no time slots today, and I did that by accident, the doctor won't be able to see you today.
And there's nothing else that can be done. Is there no other doctor to be done? And you can't cancel anyone else's bookings?
I can't, because they had already booked it, and it was my mistake for booking you on top of what was already there. And we're short on doctors today as it is.
So there's nothing else that you can do?
Well, I mean, if there's someone that you really want to speak to, I can ask you to phone 111 or attend a walk-in if you really need to speak to someone, because, as I said, other people had already booked, and your problem wasn't as important as some of the other patients today.
Excuse me, it wasn't as important. I've been waiting 2 months for an appointment and I haven't been able to have it. I've got a problem with my heart, and I've tried to call and no one believes it or takes it seriously. And then you're telling me it's not as important.
I do understand, and I get that you're angry, but please do lower your tone. I'm not making rules here, and it was my mistake. But if the doctor was able to see you today, they would, and I did what I could to try to ask them to, but we're fully booked, unfortunately.
But this isn't good enough. I've got a problem with my heart and I've been waiting for months for an appointment.
Have you tried to phone anyone else about it, like 111?
I've tried to phone you, GP surgery, because you're my GP.
I understand that, and I do get it. It's frustrating, but if the GP is fully booked, I don't know what I can do for you aside from guide you towards somewhere else.
It's just not good enough, quite frankly. It's not good enough. It's a waste of my time, and I'm gonna have to speak to someone else about this.
Yeah.
Thanks for nothing.
Sorry to hear it, but that's all I can do for today. I've tried.
You are the school's football captain, and you need to inform one of your teammates that unfortunately they didn't make the team.
Hiya, I was told that I'd have to speak with you.
Hiya, how are you today? Yeah, that's correct.
Good, yeah, good, thank you.
I wanted to speak to you about the football team, and unfortunately I don't have good news.
Oh, okay.
Yeah. So I just wanted to say, I'll come right out with it. You haven't made the team.
Oh.
I'm sorry.
Yeah, that's obviously not what I wanted to hear. Like, I've been coming to like training sessions, and I was really looking forward to sort of competing.
Yeah, of course. And from our point of view, I want you to know that we really do recognize your efforts.
Yeah.
Consistently been here, as you said. You are incredibly talented, but unfortunately, while we were doing the training process and we were looking at everyone's abilities, you didn't match up to everyone else, unfortunately. But that's not to say that you haven't done really well and we haven't recognized your efforts. How are you feeling?
Yeah, it just feels like I was putting in a lot of time into training. It just feels like it just didn't count. You know?
Oh, yeah, I'm so sorry. Thing is, we don't want you to feel like that at all. In terms of it not counting, that's not true at all. What you've done for the team has been incredible. And in fact, we recognize your sportsmanship, we recognize your time management and your discipline, and we recognize your abilities and how far you're able to actually go with it, because we've actually thought about you as a candidate who you're just in your first year of university,
Yeah.
and we see so much potential in you.
Appreciate that. Yeah. And you're right. I guess I am in first year, and I do have more time.
Yeah, absolutely. And in fact, we don't want this to discourage you from doing what you're doing, because you're doing incredibly. We want you to be a part of the team going forward as well. In fact, even though we're not able to offer you a spot on the team itself, you are going into your subsequent years, and we want you to be a role model for those who come afterwards, because you've shown outstanding leadership and skills, and we really do recognize that. And as I said, even though we're not able to give you a position on the team itself, we would love if you would be a part of our team and be, if you're interested, a coach for the years that come in afterwards as well, for the next year. How does that sound?
Yeah, that sounds great. Yeah, I really appreciate your kind words about that. And I get that, if I didn't make the team this year, then I've got next year and everything else. And as you say, like, I am in my first year, so I've still got more time.
Absolutely.
So, yeah, I really appreciate that. Thank you.
Yeah, no, we'd love to have you as part of our team. We do really see what you've done, and don't let it discourage you. I do understand that it's a little bit of a downer, but you've done really well, and it doesn't say anything except we just need a little bit more practice, and you're going to get there, because you've done so well already so far.
Awesome, appreciate that. Thank you.
You're very welcome. And if you need anything, please don't hesitate to come back and let us know.
You want to speak to a patient who is currently taking herbal medicines and doesn't want to take tablets for their medical condition.
Hi, Doc.
Hiya, how are you today?
Yeah, good, thanks. How are you doing?
I'm fine, thank you. So I can see that you wanted to come in to have a conversation about your medicines.
Yeah, that's the thing. So I went to my healer about the thing that you were mentioning about what's it called? The angina, I think it is. So yeah, basically, I just don't think I want to take tablets. I just don't want to take tablets.
Okay. So thank you for coming in and letting me know that. It's a good thing that you've come in. You've done the right thing. We can have a conversation about it. So can I ask, what is it that your healer said, and what is it that you're taking after their advice?
Yeah, so it's just obviously you told me that I had angina, so then I went to the healer about it, and they gave me like a recipe that I can then have for it, basically. So I just don't feel like I need to take any tablets,
Okay. And how's the pain with the recipe that you're taking at the moment?
So it hasn't made any difference at the moment, but I think my healer said that it will take a bit of a while.
Okay, all right. And from my point of view, as your doctor, I obviously am here to say that these are some tablets that we can take for your pain. And when you say that you don't want to take them, it's important for me to understand why. So can I ask, what is it that stops you from the tablets?
I just don't want to be on tablets. One, for the rest of my life.
Yeah.
And also I just find it difficult to swallow.
Okay, all right, fine. So there's a few things that you said there that I just want to talk to you about. Now, with regards to the herbal medications or the recipes that you're using, from a healthcare point of view, I completely respect and understand the choices that you make. You're entirely entitled to do whatever it is that makes you feel comfortable and you feel like is helping you as well, perhaps now and in the long term. But from my point of view as your doctor, we obviously are big advocates for evidence-based medicine. And so it wouldn't be my place to speak on the herbal recipes that you're using as to say whether they're good or they're bad, because I simply don't have the knowledge to talk on them. With regards to the tablets, it's a very valid concern that you don't want to be on tablets for the rest of your life, and I completely understand that. And what we could trial, if it's okay with you, is if at all you did want to consider the idea of tablets, the problem with the swallowing is something that we can help you with. For example, rather than giving you tablets that you need to swallow every single day, we can give you sachets instead, which you can dissolve into water and then have.
Oh, are those the dissolvable thing, like Lemsip, like dissolvable?
Yeah, exactly.
Yeah.
So it's,
Okay.
and have you ever had Lemsip before?
Yeah. I think I saw actually a friend that had something similar, like you can sort of dissolve it.
Yeah, and how are you with the dissolvable drinks?
I think that could be quite good. It would mean it's it's not going to be difficult to swallow. It makes it sort of easier to do because they're quite big tablets,
Yeah, and what we can do is, if we gave you smaller tablets or we gave you these dissolvable tablets, we can see how you get on with them alongside what you're doing with what your healer said. And if at all that you're coming back with anything that's unusual for you or you're worried about it, we can again look back and have a think about what's going on and what might be best going forward. But just from my point of view, I want to let you know that if you decide, I really want to give you the time to think about whether you want to take these tablets or not. And if you decide that you do, I want you to know that there's support available in terms of giving you alternatives, sachets and smaller medications that you can take. And if you want to go back and have a think about it yourself, are more than welcome to book another appointment and have a conversation about it. What do you think?
Yeah, that sounds good. Because to be honest, I don't really usually go to the doctors that often. I just try and avoid it. I just don't like it, to be honest. But yeah, you know what? You're right. Let's try it out in terms of those dissolvable sachet, I think you said, and we can sort of go from there. Yeah, that sounds good.
Of course, it's a scary start, and you're used to what you're used to, and I appreciate and respect that. But from my point of view, and like I said, with practicing medicine, with the evidence that we have, we know that these tablets work for the condition that you're having at the moment. So if you are willing to give it a go, that's brilliant, and we can trial it and then see how you get along. And then if you still need more time to think about it, that's also completely okay, and we can come back and discuss it together. Is that okay with you?
Yeah, that sounds great. Thanks, Doc.
Okay, brilliant.
Why are you deciding to pursue medicine? Why not biomedical sciences or nursing?
The decision to study medicine over degrees like nursing and biomedical sciences was really consolidated by my work experience. I was able to shadow junior doctors at a hospital, and when new patients came in, I observed the way they approached a new patient to come to conclusions about the problem and the diagnosis. For example, there was a gentleman who came in with chest pain, and initially the doctor asked a question about what had brought him in, and I was quite surprised by how long the patient was talking for, and also surprised by the fact that the doctor was not interrupting the patient, especially when it seemed as though they were going on a tangent, talking about their recent activities, the holiday they had been to and what they'd been getting up to there, the activities they've been doing, and what they had been doing socially as well, including drinking. And what I wasn't able to understand at the time, but upon reflection was able to appreciate, is that by starting with an open question, the doctor was able to provide an opportunity for the patient to give information, and in doing so, the doctor was gathering information. And if things weren't particularly relevant to the conversation, the doctor would guide the conversation back by saying phrases such as, I understand that that might be a concern for you, but it isn't something that we'd be worried about at the moment. And so I was really able to appreciate how the use of an open question not only allowed the doctor to gather a lot of information, but also enabled the doctor to expand on the points that the patient had made, as opposed to it sounding like a very grueling interrogative sort of discussion. And the value of this really came from the way the doctor took the conversation aside and was really able to look at the problems that the patient had come up with. For example, I didn't really notice the fact that it was important for the patient to talk about the activities they had been doing. For example, to give information such as whether they had hurt their chest at all by doing anything, the fact that they'd been drinking, is that something that could have contributed? And so by using the techniques of open questions and then later using closed questions, yes or no questions, such as does the pain feel sharp, allow the doctor to narrow down the problem. And that element of problem solving is something that I truly appreciate and value as part of the daily life of a doctor. And importantly, I was able to see how the doctor was also able to make decisions about the patient's care. So very, very logically, the patient has come in with pain, and as opposed to thinking about things in a very, very scientific way, the doctor enabled me to think laterally and say, well, if the problem is pain, what are some of the first things we can offer them? Painkillers. And it was very nice to be able to strip back the thinking and see how to manage a patient from a basic point of view before considering the larger picture. While I was on the wards, I was also able to see the nurses, and something I observed quite prominently was their involvement in patient comfort and also taking observations, as I now know, at the bedside. However, their absence in the decision-making process and making decisions for the patient's care is not something that particularly appeals to me. Although I appreciate their role in managing the patient on an hourly basis. And whilst I didn't get to directly observe the roles of the biomedical scientist, I do understand that they take part in analysing samples and looking at blood results, which gives us a very important picture about the patient's health. However, the absence of the communication with patients is something, again, that isn't particularly interesting to me, and I would much rather be on the other side where doctors are able to communicate with patients and actually make informed decisions about their care.
Tell me about an example in which you saw the importance of the multidisciplinary team in your work experience.
A multidisciplinary team is essential to patient-centered care. I was able to value the importance of this by sitting in a multidisciplinary team meeting for patients who had had a stroke. The single most important aspect of that meeting for me as a student was to appreciate the roles of several different healthcare professionals in the care of one individual patient beyond just doctors and nurses. For example, I was introduced to the role of occupational therapists who ensured that these patients were able to approach their day-to-day living in terms of their personal hygiene, the cooking, the cleaning, and self-care. And indeed, where they saw an issue, they would communicate this and organize a package of care that the patient may need, which may come in the form of carers coming to visit once or twice a day or every other day to ensure that the patient is managing. Additionally, I was able to appreciate the role of physiotherapists, and not just in the element of movement, but in balance and sensation, which I had neglected alongside the role of speech and language therapists, because while I understood that perhaps voice and speech may be affected, I didn't really think about the ways that balance, sensation, and in terms of speech and language therapy, the swallow may be affected, which reinstates the constant learning environment that medicine provides, and in fact meetings like this provide a stimulating environment to appreciate and learn about the different specialties and how they come together to really appreciate each other's roles, as was seen in the meeting, where they showed a real appreciation and value for each other's input in the patient's care. And even with the doctors who were in charge of the patients, they demonstrated not just the ability to lead, but the ability to pause, listen, and action the inputs of the occupational therapist, the physiotherapist. So it was a very, very stimulating but respectful environment in which I could see qualities of every healthcare professional coming into play. I also saw the roles of pharmacists, where it was very important to me how empathy wasn't just shown in front of a patient, but also behind the scenes, where they recognize that the patient has gone through something quite difficult, and in the case where the patient may have other existing medical conditions, pharmacists would come up with ways of creating dossier boxes or plans for the patient to ensure that they're able to take their medications correctly and on time. And again, on this note of empathy, I was able to not just view the practical aspects of care that a multidisciplinary team would provide, but also the holistic aspects of care. So, for example, thinking about whether they would need, whether the patient would need a counsellor to talk about the experiences that they had gone through, a liaison sister who may be able to navigate this process with the patient themselves, but also the patient's family, and talk about how best they can support them. And again, this meeting was made ever more inspiring in the ways that there was a real source of communication between each of the specialties, where there would be stop and pause and conversations such as, what do you think? And there was a genuine regard for the expert opinions of the physiotherapists, of the counsellors, of the specific stroke teams. And so ultimately, by being a part of this multidisciplinary team, I was able to observe specialties beyond just the typical ones that I was familiar with, and now have a broader understanding of the many different roles that come into play for one individual patient care, such as the physiotherapists, occupational therapists, counsellors, and also the need to consider patients not just practically but holistically.
A patient refuses life-saving blood transfusion. What aspects would you consider?
It's very important to acknowledge that this is a difficult situation, and in fact an ethical scenario which requires consideration from many different angles. If I was a clinician in this situation, it's important to understand that I'm coming into the situation with my own agenda, which is to provide a blood transfusion to save the patient's life. However, the patient has their own agenda, their own wishes, their own experiences, which will inform their decisions. And ultimately, it's very important to understand why they are refusing the blood transfusion, and being able to facilitate an environment that allows them to have this conversation openly and in a safe way. The pillars of ethics, for example, non-maleficence, ensures that no harm is done to a patient. And while from a clinician's point of view, providing the blood transfusion may be the answer to this and ensuring that the patient is safe, it's very important to consider the patient holistically. For example, if the patient is refusing blood transfusion on the grounds of religious reasons, for example, being a Jehovah's Witness, it's very important to consider if the notion of non-maleficence is sustained even post the patient's care, because it's important to explore whether this decision would affect them outside of the hospital, where they may be shunned from their community, lose friends and family as a result of the decision, and may affect their home and personal situation, which could be argued as not providing a full means of non-maleficence for a patient, and considering their entire social, personal and emotional well-being. And again, it's very important to be able to facilitate an environment which allows patients to communicate these things and make decisions effectively. Another important consideration is whether or not the patient is able to consent for the decision. I was able to see this in my work experience, and my understanding of this is where a clinician can give information and the patient needs to be able to understand it, and so speaking without jargon, using simple terminology, and asking the patient to repeat back to make sure that the doctor has made sense. And the patient needs to be able to understand the information, to hold it and retain it long enough to be able to say what's the advantages of having the blood transfusion and what may go wrong if they didn't, and if they fully understand the consequences of that, and then be able to communicate clearly whether they do want it or don't want the transfusion. And there are several things that can affect whether a patient is able to consent. For example, if they've come in with a head injury, so being able to assess the patient fully, and also practical things such as whether the patient has just gotten off a bad phone call or had a really bad night and wasn't able to sleep and is in a very difficult situation at the moment. So being able to speak to them at a time and a place that is effective and convenient is very important. For example, not in a busy ward where you can barely hear one another. And certainly if the patient requires additional support, such as the use of a translator, that sort of measure needs to be in place to enable the patient to make an informed decision about their care. Ultimately, the patient has autonomy, and that is entire governance over the way they want to go about their care, and it's important for clinicians to respect their decisions, their experiences and their boundaries, while also accepting the limitations of a doctor by accepting that perhaps a blood transfusion may not be what a particular patient wants. But in summary, it's very important that for decisions including important healthcare management, a clinician needs to approach the patient in the right situation, the right scenario, with the right means of support, such as the use of translators, and truly explore the reasons why. And where it is difficult for me in this scenario, I can offer to include other members of the healthcare team who are senior to have these conversations openly, and of course religious members of teams.
What are the long-term negative effects on COVID-19, but what are the solutions to these problems?
COVID-19 highlighted the incredible efforts of the frontline staff in the NHS and brought about a lot of positive change towards healthcare. However, it's important not to ignore the long-term negative consequences of COVID-19, as this pandemic provides us an opportunity to reflect upon those and consider the developments that can be put into place for the future of our healthcare system and a well-rounded means of patient-centered care. One of the long-term negative consequences of COVID-19, as we have seen with many diseases in the past, is public opinion towards vaccines. And from a healthcare standpoint, it's very important to truly empathize and consider the reasons why people have their fears, their hesitations, and their experiences that govern the reasons why, for example, they refuse the COVID-19 vaccine and all of the boosters. And one of the players that can have an influence on this decision is the media. And it's quite important for us as future cohorts who have experienced the pandemic firsthand to consider the opinions of those around us, friends and families, their attitudes towards the pandemic, towards the introduction of vaccines, and provide a very unique standpoint about the reasons why people have their hesitations, have their fears towards trying something new like the COVID vaccine. And one of the things that I personally was able to understand is the fear-mongering that occurred as a result of lots of media being shared with regards to people's negative side effects of the vaccine. And something that was quite important as well was the difference between true sort of effects of the vaccine and misinformation, which can be skewed by the fact that everyone is going through a very difficult time, and it's very hard not to be able to access the clinicians as easily. And so for a future perspective, us as students and further healthcare professionals, we have a unique opportunity here to really reflect on the things that made it difficult for people to come to terms with the vaccine and in fact decide on taking the vaccine. Especially where media was an element that influenced that decision. And we're able to think about the ways we can work with public health to not just do as we're doing now, which is to provide and educate the public about reputable sources to gather their information, for example, the NHS websites. But in fact, if they are given access to studies or articles which explore some of these effects that people have been having, to be able to navigate that and think about the basic points that they can look out for, such as how big was the sample, who was the population, because it's quite easy to think that only clinicians and people who are working in that field will understand that information, but where it's so openly available for patients to access, it's a means of opportunity to provide more information and education for the public, to provide a sense of ease and support and an understanding about the resources that quite often get thrown to us. And so ultimately, the pandemic provides an opportunity for us as future cohorts to work with public health to educate our communities. COVID-19 also saw a lot of backlog and a lot of demoralized staff in the NHS as a result of the pain and the sheer emotions that had to go with looking after a cohort in the pandemic. And I think this also allows us to understand the effect of death, the effect of providing for patients on healthcare workers as well, and considering the measures that need to be put in place to ensure that those at the front line are also given a means of support, counselling and therapy in order to be able to effectively and healthily deal with the issues that come through the doors every single day. And so to summarise, not only public education, but the work that can be put in within the healthcare system as well to benefit both staff and patients.
You are the new Health Secretary and you've been given £1 billion to spend on the NHS. Where would you spend it?
I became particularly interested with screening and preventative medicine while I was volunteering for a GP practice. I was tasked with booking appointments for women for their smear tests and was surprised by the number of women who declined and were happy to provide reasons such as they didn't feel they needed another one as the last one was okay, they weren't very comfortable doing so, and for new patients who needed it, for the first time, they expressed how culturally and from a religious perspective, they didn't know if this was something that they would be okay going forward with. And ultimately, I think patients have utmost autonomy over their care. However, I do recognise, coming from a background myself where sexual health was very much a taboo, that there is a need to bridge the gap between medicine, science and culture in a very respectful and informative way. And so In line with core values of the NHS, which is to work together to help patients, I do think that funding towards screening workshops, which outline reasons why these screening programs exist, what occurs within them, and also, more importantly, providing the opportunity for patients to ask questions in a safe and comfortable environment is very important for the prevention of disease ultimately, where providing the right sort of information from controlled and effective sources, such as doctors and nurses, it would be very, very beneficial in this case for the screening of cervical cancer and helping a lot of women in that way. And importantly, we can also include the involvement of religious members of communities who can provide the cultural religious perspective that some patients may need before making an informed decision about why they are either rejecting or accepting the smear test in the end. Another area of medicine which I feel requires funding is multiple sclerosis as a specialty. As a neurological specialty. I remember in sixth form being very, very interested in the ways that I could couple medicine and science and creativity for innovative advancements in the future. And multiple sclerosis was a topic that particularly interested me in A-level biology. And quite simply because thinking about the fact that around cells, the myelin sheets degenerate, I couldn't help but consider, are there ways to artificially synthesize myelin sheets to support those with multiple sclerosis at present? And through my work experience, I've been able to see that doctors don't just exist within wards and in other settings to diagnose and treat patients, but they also work collaboratively in research, which again is an effort to provide the best means of support for patients. And I think when we are advancing towards modern medicine, questions like these are very important for me to have, so that as I keep developing through my career, I maintain that level of curiosity. And with funding provided to areas of research like that, I believe I could be part of such efforts in order to help as many patients as possible from a cellular point of view. And equally, on this sort of note of considering creative, innovative advancements in medicine and screening and detection, I think something that's quite important to me in the screening field is to look into the efforts that are being put into screening younger patients, especially for breast cancer. While it's quite recognized as there is screening in later stages, I think it's equally important to consider the way disease manifests in younger people. And again, funding that could go into research towards that in collaboration with screening efforts would be incredible for patient care going forward.
You are a medical student and a family member asks you about a rash. What do you do?
Consider the situation or setting that the conversation was being had in. If the family member brought this up in front of others, I would say something like, should we go next door? Would you like to go to a free room? So that the conversation can happen in a respectful and dignified way. And I'd be careful not to say phrases like, let's talk about it more over here, because it would be unfair to allude to me actually having an expanded conversation about the problem, because I recognize my limitations as a medical student, and more importantly, my responsibility as a medical student and eventually junior doctor to uphold that sense of responsibility, not just within the wards, but also outside of the hospitals as well. So once we are in an appropriate setting, I it may be that the family member carries on talking about what's been happening with their rash, and here I understand that it's a very difficult situation to balancing between how long I allow them to speak for, and also recognizing that there is a need to be honest and open and really show that integrity with regards to the career and my role, by saying first and foremost that unfortunately I am a medical student and it's not appropriate for me to have this conversation with you. And what's important here is to really involve pauses during this conversation so that I can hear their perspective, because I recognize that with family they may say something along the lines of, well, it's okay, just have a look and let me know what you think. And at that stage I think it would be important for me to reiterate these things, again using both verbal and non-verbal techniques, so maintaining that eye contact, speaking to them in a gentle tone, and perhaps sitting down and leaning forward to say, unfortunately, as part of the General Medical Council, the rules and the guidelines that I must follow, I'm not allowed to be having conversations with family members about their conditions, whether it be a rash, a cold, even if it's nothing that's super serious to them. It's not fair for me to have these conversations with you. And I'd explain why, not to just say that I don't want to help them, because I think it's very important to reiterate that as their family member, I do very much care for them and empathize with the fact that they're having an issue. So for example, I can include phrases like, I'm really sorry that you've been having this rash and it's been such a nuisance to you, clearly. But then going forward to explain that actually, even though I care about you so much, I'm not allowed to be having these conversations with you because ultimately it's for your safety and it's for your well-being. It would be very, very unfair of me to look at something that I'm not awfully familiar with and give my opinion on it, because it can be very harmful for you as a patient, and as a family member of yours, I would never want to put you in that position. And so explaining that in a kind and tentative way would be very important. And ultimately, just from a consequentialism point of view, I can express my limitations because I am a medical student and I don't know enough at that point to be able to provide a diagnosis and a conclusion about what needs to happen further. It would quite simply be unfair and very irresponsible of me. And so in this conversation, I think it's about upholding those core competencies of a doctor, which is responsibility, honesty and integrity, and true empathy in this situation. So while I am saying that I cannot talk to them about this, I can offer to say, I understand how hard it is to get hold of GPs at the moment. I'm more than happy to wake up at 8 o'clock one day and book an appointment for you so that you are able to talk to the GP about your concerns and ask if there's anything that I can do further with regards to getting them the support that they deserve and need from an adequate and qualified healthcare professional, as opposed to me as a medical student, and ensure that they're feeling okay with everything that I've said at the end as well.